non-compressible fluid coming between the catheter and the transducer. And if you get an air bubble in there, the air is going to be compressed and it throws everything off and you get a false low reading. Excuse me. Okay. So you just kind of put the IV fluid in this pressure bag. You see that little hanger thing pulls through. Okay, so you put that in there, and then you can go ahead and put this and spike the bag. And you'll notice I haven't inflated the bag. You don't inflate the bag until you prime everything, or else you're just going to blow a bunch of bubbles through here and make it work harder. Okay, so what you need to do then is just squeeze that drip chamber a little bit, and I'm going to want to open, okay, so I open that roller clamp, but then I have to, you see the fluid squirting out of the back? I need to open the flush, and what I'm going to do is flush this segment of the tubing and make sure I don't have any bubbles in here. That's the thing I want to do. So just kind of flush, and I've got the stopcock turned, and I'm just going to flush. Liquid's going to go in the trash can, okay? So I've got water out of there. Sometimes you can turn, sometimes bubbles get stuck in here, and if you turn it and flip it a few times, that's going to knock the bubbles out. So I'm looking at that tubing pretty carefully. I don't see any bubbles. So I'm good. Now you notice I did take, there was a white cap on there.
Mm-hmm.
Those are called vented caps. And they,
It's in the trash can.
yeah, I threw it in the trash.
Oh.
It's a vented cap, and it lets, when they sterilize this, they sterilize with something called ethylene oxide gas. And the gas will flow in through a little hole in that cap. But you don't want to hold the cap, because what you're going to do is take one of these yellow ones and put it on there, because these don't have a hole in the cap. See, the important thing is if this stopcock gets turned, let's say it gets turned, if it gets turned this way, we might get blood from the patient coming up through here and out through the cap, through the stopcock. So if this stopcock if this cap had a hole in it, the blood would come up out of the patient and go out onto the floor, just if they accidentally twist this. So you don't want that. Okay, you need to replace it. It also keeps everything cleaner. You want to avoid contaminating the stopcock. Okay, so far so good. So I've got that. I've put the stopcock's basically where this lever goes is where the fluid's not going to go. Okay, so if I turn it this way, the fluid's going to go this way and then out the stopcock. If I were to take the cap off, all right? Does that make sense? So the fluid would go this way. If I turn it this way, what's going to happen? The blood's going to come up from the patient and go out. This ends to the patient. Okay, so let me just go ahead and prime a little more. See, I was holding this up too high. I can't run uphill. I need to hold it down lower. So that looks pretty good. I don't see any bubbles in this tubing here or there. So I'll put another yellow stopcock on and flip this so it'll run. And so now there's fluid coming out all the way. So we've got, so you can feel that too. You feel how it's kind of firm and it's hard to, you never going to get a chance, but you compare, when you come up here and look at this, this is like regular old IV tubing and it's kind of soft and compressible. This one's real rigid and it's not compressible. So the whole idea is you want, the lumen of this tubing should be full of the fluid, the saline, and nothing but saline, so no bubbles or anything like that. And this tubing is non-compressible. So the idea being that you're going to get the same pressure here is going to go in here, and this is what they're going to watch, okay?
So the blood that's coming from your artery into here will like push on there, and that'll cause
The blood, you shouldn't see blood. So what I'm going to do now, so this is all primed, right? What what I'm gonna do is I'm gonna go ahead and inflate this bag. Okay, so again, you don't wanna do this until you've got the line primed, or else you'll drive bubbles into the line, and then you'll have to work extra hard. And watch here, this little thing is popping out, and you wanna keep pressing on this until you see the green, color. Okay, so this line is pressurized, and I need to have more pressure in this line than in the patient's artery, or else the blood's gonna run backwards. You don't want that. So you don't want the blood running back. You just want the pressure of the saline going back. The other thing is the pressure's going to, there's a device in here called an intraflow. So in here there's something called an intraflow, and this allows a little bit of the saline to drip through the tubing here, and it's going to prevent a blood clot from forming on the catheter, the tip of the catheter. Okay, and also you get more pressure. So I've got some pressure here, and I can flush. You see, so that's the pressure driving it out. Okay, so that's basically how you set up a central line. Now, once the central line is set up like this, we can go ahead and put the catheter in the patient and hook this up to the patient, and then what we need to do is zero the line. Okay, and I'll talk. It's kind of like calibrating. So I don't know how this really didn't come out too well, but basically you can see the parts of this pressure bag, this pressure monitoring system. You have the catheter. So this is the catheter. Then this is the three-way stopcock, and then it goes up here to your intraflow, and this shows an intraflow and a transducer. The transducers used to be reusable, and you just kind of plug tubing into them, but now they're so simple. You know, the electronics have gotten so simple and so cheap. It's all, everything here is disposable. But it used to be just the cover of there was like a cover that screwed on a transducer, but we don't do that anymore. Okay, and then there's just the rest of this tubing that fits a lot like a plain old IV tubing from here on up, plus the pressure bag. Okay. So we can all mess with this in a minute, but let me just go ahead and talk a little more about ALAS.